Hello, residents of Elwood. This is your friendly neighborhood superintendent of schools, Ken Bossert, coming to you with a weekly update. I actually had to write some things down this time. I usually speak off the cuff, but today I'm going from script to make sure we hit all the important bullets of the week. It's been some time since I last gave an update. I want to make sure everyone in the community has a good sense of what is happening within our school district and some things that may be forthcoming on our horizon. I want to start with good news. The glass is definitively half full in the Elwood School District. We successfully opened the valve a bit this week, welcoming back 100% of our sixth grade students to join our K-5 students in attending school every day. It happened seamlessly, it happened successfully, and we are very pleased to have them back on a full-time basis. In addition, just yesterday, we began instructing our 7th through 12th grade students on Wednesdays. Initially, we had been, as you know, virtual at secondary level for deep cleaning on Wednesdays. But yesterday we had the A cohort in. It was like any other Monday or Tuesday to have them here. And our deep cleaning took place last night rather than during the day as it had been. We look forward to seeing the B cohort next Wednesday, and we'll move forward from there as we evaluate the impact of opening the valve. It happened at an interesting time. As the infection rate is increasing dramatically in our region. But we'll talk more about COVID in a bit. There are good things happening in the Elwood School District. This was Spirit Week, or this is Spirit Week at John Glenn High School. This year we weren't able to have our typical pep rally or homecoming festivities, so the team at the high school did a great job replicating some of the more fun aspects of that we can do with our COVID restrictions. And I thank the team for putting those together. For the first time ever, we have live streamed those activities. We live streamed cohort A earlier in the week, and cohort B's activities for seniors will be live streamed later today. Please check that out if you are interested in watching our senior class play chicken neck out and other things that they will enjoy. And thank you to everyone who's helping to make that happen. Instructionally, things are moving forward. Our students are benefiting tremendously from engaging with one another and their teachers, whether it be in the hybrid model here or a fully remote. You know, some incredible work being done through the AP Capstone program. I look forward to reporting that more to the community. Kudos to Mr. Greening and Mr. Chesnoff, our teachers from the high school, who have a good number of our students delving into research topics that are so diverse and so deep that I truly look forward to them completing their projects. You know, with the level of depth and real interest that the students are taking in their own work. It's amazing what's being accomplished at the high school level through the Capstone program. So congratulations to the students that are involved in that. I really look forward to seeing your finished product. Our equity work continues throughout the district. All 4 of our buildings are now partnering with the ADL, the Anti-Defamation League, as a No Place for Hate school. Students are saying the No Place for Hate pledge. They're learning about all of the important aspects of treating people fairly, equally, and with respect. And you know, some of the pillars of that program are well in line with the lessons that we are trying to teach in Elwood. And I appreciate our continued focus on making sure that everyone that attends our school district feels comfortable, supported, respected, and celebrated. Lots of other good work going on within our classrooms. You know, it really gives me great pleasure to see, you know, our teachers stepping out of their comfort zone, discovering new computer-based resources to help them instruct the students, and just do their best to not let the obstacles that we're working under in any way inhibit the productivity, the creativity that they have with their students. So kudos to the staff, and parents, thank you so much for the partnership. We know that our students working remotely in some cases and in a hybrid model in others is an additional burden on your household, is an additional exhaustion of your time. But without your partnership and your support, our students would not be making the progress that they are. It truly takes a village, and we thank everyone for the role that they are playing. COVID things. You may have heard about New York State creating a zone system, yellow, orange, and red. Those zones are indicative of increased positive rates in COVID testing. After Halloween, there was certainly a surge in our region and around New York State. where we saw some real significant spikes in the infection rate in certain communities, ours included. We went from hovering around 1% for a good period of time to soaring well above that in many areas. Some places on Long Island went as high as 13%. Very scary. That spread is not happening in schools. I think that is the most important point I can make to you. There has yet to be a case in Suffolk County where a student tested positive or a faculty member tested positive in the school, and then there became other cases based upon that exposure. Why? We're wearing our masks, we're practicing appropriate hygiene, we are distancing to every extent possible, and we are being very cognizant of our cleanliness and making sure our buildings are safe places for students. So there is yet to be a case, and certainly not in Elwood, where a singular case has become multiple cases. Spread is happening in the community, spread is happening within families. I heard Governor Cuomo's press conference last week where he introduced the term family spread. That's something that we are concerned about as Thanksgiving approaches, and people making decisions to, perhaps leave their home, get together with, large groups of family and travel and things like that, which I'm sure is why the executive order is trying to limit that. Now, people are going to do what people are going to do, and hopefully they'll respect the cause of the common good and keep those travels and group sizes to a minimum. But it would be foolish to think that we may not see another surge following the Thanksgiving holiday. In addition, we have entered the cold and flu season, so we have competing factors that are contributing to the increase in the infection rate. Not in the school district. We have had minimal numbers of positive cases. The community has been informed each one we had. We have not hidden any from you. So the ones you're aware of are the only ones we've had. By comparison, in some other districts, we've been very fortunate. I'm not sure there's anything special we're doing here that other surrounding districts aren't doing. So it really boils down to the community being supportive and doing everything you need to do to keep yourself and your family safe. So I can't tell you how much we appreciate that. But we also need to prepare for the inevitability that our infection rate in our region may increase to the point where we will not be permitted to stay open without having a testing program in place. If our district is part of a region that's identified as a yellow zone, which means a 7-day average of infection rate going above 2.5%, we're very close to that threshold right now. If we're identified as a yellow zone, we would have options. One would be to close our district buildings and work remotely for at least a period of 2 weeks. That's not a good option. All of the research indicate, all of our own observations indicate students are safe in school and they are better off in school. We know it's best for them instructionally. We know it's best for them socially and emotionally. That is why we are going through Herculean efforts to try to keep them here within guidelines to every extent possible. That's why we opened the valve a bit. That's why we'll look to do so in the future after the infection rate levels off, and we can do so safely and with peace of mind. But if we become a yellow zone, we would be required to have a testing program in place, a COVID testing program. And we would be required to test voluntarily, mind you, 20% of our student population and 20% of our faculty and staff. We are working very hard as a region. I'm very active, as you know, with Suffolk County Council of School Superintendents. So the SCSSA has partnered with Suffolk County Department of Health Services to try to implement a testing program that works not singular district by district. There are 71 districts in Suffolk County. Each one of us working independently to try to work with a third party to establish a testing program for the students and staff. That's possible, but it's not wise. So what we're trying to do is partner with Suffolk County Department of Health Services, Dr. Piggott, an Elwood resident as commissioner, and been very, very helpful and very, very communicative and very responsive to calls from Elwood. So thank you, Dr. Piggott. We're trying to put a testing program in place that would work not only for our school district, but every school district, and to make it a regional testing location, much like we saw at the height of the pandemic with the large drive-through facilities that were placed on college campuses and places like that, so that large volumes of people could be tested without disrupting the other operations that we would have as a school district. New York State Department of Health has made it clear they can supply the tests that we need, the nasal swabs. We would have to talk about the protocols for making sure we have consent, making sure we have an adequate representation of our population, and also how to process the results. So that is everything we've been working on the last 2 weeks, and we're making great progress. The very first district on Long Island that had a high infection rate, in Suffolk County, I should say, and put in a testing program was the Hampton Bays School District. And I worked very closely with the superintendent there, Mr. Clemenson, to help to design what that testing program looks like. It was put into place this morning. It's working effectively. They will be able to test 20% of their overall population in the matter of just a few days due to the partnership with the county. The county helped them secure the test, the county helped them to secure the personnel, and the county helped them to set up the facilities necessary to give the tests and report the results. So that shows it can work. That shows it can be done. New York City schools took a different action. If you did not see the announcement, New York City public schools went to fully remote instruction starting today until further notice. That's what we're trying to avoid. It is very unfortunate that the city schools don't have the same resources, opportunities, funding, personnel that most, not all, most Long Island districts have available to them, and certainly we have available to us in Elwood. We can try to make a testing program work here and make it work effectively, assuming that's what the community wants in order to keep our schools open. It is unfortunate that city schools continue to struggle with their ability to do that. Districts lacking financial resources have struggled to provide adequate virtual instruction. And what we have seen during the pandemic that is very upsetting to the educational community is a greater spread between the haves and the have-nots. And New York City public schools closing for virtual instruction is a giant example of that. They don't have the resources to do what many other districts outside of the city are able, including Elwood. So we've worked very hard to put together the proposal for a partnership with Suffolk County. It's working for Hampton Bays. They piloted the initiative. And again, I was lockstep working with the team to help put that together. So all the documents that were created for them to achieve consent to test, to put together that random sampling, to schedule appointments, the schematic for what the room needs to look like, the amount of personnel that's needed. I have all of that. So much like I've said, we're prepared to flip the switch should we need to go to virtual instruction for a small period of time or even a singular day or a lengthy period of time, we're ready. We're ready to move to a testing program should we need to. We're close to it, I should say more accurately. We have the resources and the people in place. We just need to make sure it works, and we're looking to do it regionally, not looking to have a testing brigade going in and out of the middle school cafeteria. We are looking to form a partnership with the county and the other districts in our region, Northport, Huntington, etc., to put together a regional testing location that all of our residents would jointly be able to take advantage of. We will need your help. There's a few aspects of that. Again, it's a voluntary program. 20% of our parents have to give us consent to test 20% of our students. Without that consent, we don't get the random sampling that's required. We can't keep the schools open. I don't think it's going to be a problem. I was really encouraged when Mr. Clemenson shared with me in Hampton Bays, when they put out the consent for interest in testing, he got 100 responses within the first hour. 90 of them were affirmative, people who were willing to be tested in order to get that random sampling to keep the schools open. That's great, and the testing is taking place today. So we will need that support. We also may, and please hear this and look for it, we may get to a point where we're asking for community volunteers with medical backgrounds to assist us with the training. We would put together a pool of qualified medical professionals, whether you're a doctor, a nurse, or otherwise, or an EMT, or a police officer, or a firefighter who has this type of medical training and can assist us in attending a 3-hour training session. That's what's required to become certified in the eyes of New York in order to be able to effectively give the nasal swab COVID-19 testing. Of course, there needs to be medical professionals to record the results and deal with any positive results. But to administer the test, it's a 3-hour video course that needs to be completed in order to be certified to give it. So we may use some internal staff, but we may be also looking for community volunteers. And I have a sense after you watch this video, I'm going to get a bunch of emails of people who are willing to do that. I appreciate that. But if the time comes, you will get an official email asking you to respond if that's training that you have and a service you're willing to volunteer for the district. So we hope we don't get there, but we want to be prepared if we do. We hope that our region is not identified as yellow, orange, or God forbid red. That means there are members of our community who are sick and who are suffering. We don't want that, but we need to be prepared of the event of an eventuality where that may occur. So our goal, again, I've said it all along, is to keep our schools open in a safe way. On the other side of the coin, if it is ever determined that we cannot open our schools safely and that our schools could increase risks to health and safety of students, faculty, or staff, we will close. And by closing, I mean shifting to remote instruction. That is not our goal. Our goal is to remain open in a safe and healthy way. I shared with you in a written correspondence, or perhaps it was last week's video, that one of the challenges here has not been an over reporting of positive cases. We have had a significant number of faculty and staff members, and students included, who were exposed to positive cases and subject to quarantine. Our staff has been very thin because of that, and we have people going to extraordinary efforts to make sure the needs of all the students are met, despite the fact that on some days we are down 10 or 15% of our overall staff. In a typical year, it's about 1 or 2%. Our attendance rate in a typical year is 98, 99%. This year it's 85%, 90%. That's significant. It really thins our ability to do the things that we typically do. So it's an atypical year. We're doing things differently. We have people playing roles they don't generally do. Dr. Toscano reported to me how much she enjoyed teaching some classes that needed to be covered last week at Boyd. Those are the types of things that are happening to keep the system open and going. Our teachers are really going above and beyond to make sure that we're filling any gaps that may exist because of staffing shortages. And we've relied heavily upon our teachers' assistants, our paraprofessionals, our substitute workers to make sure the systems are a go. Thanksgiving is coming up. We want to wish you all a very healthy and happy Thanksgiving, but I hope that you intend to practice the safety guidelines that will help our community spread to be minimized and to really keep our families and our students safe and our schools open. I'm not going to be preachy and tell you what is in the best interest of your family. I'm simply going to state that our goal is to keep our schools open and keep our students in the buildings. Everyone needs to do their part in order for that to happen. And I will do the same. So I believe, checking my notes, I hit each of the bullets I wanted to discuss with you. If at any time you have questions or concerns about our instructional program, about COVID-19, please reach out to the correct person. Our nurses have been wonderful resources to our parents, answering questions that you may have. Thank you so much for responding to the Sunday night survey so we have a sense of what's going on. We've been able to address concerns before they enter the buildings because of your communication, and we appreciate that. So when you have questions, please reach out to your child's teacher if they're instructionally. If you need additional guidance, our principals are wonderful at communicating with parents and answering those questions. And if anything rises to the level where you need to speak to our district office administrator, we're all here and we're here to help. And to those parents who have reached out to me, the kind words you shared have been greatly appreciated. Those kind emails that you send are truly chicken soup for the soul as we sit here trying to govern the district on March the 200 and whatever we're up to. It's been a interesting time since March, and while we're hoping for some calm, we know there may be a bit more storm before that. News of 2 vaccines being close to approval and distribution is wonderful. Perhaps that's how we get back to normal, but it may take some time. We know that. So we're willing to do whatever we have to do to navigate that time. I've been long-winded enough. Happy Thanksgiving to all. Please stay safe, please stay healthy, and please be thankful for everything that we do have to continue to celebrate with one another.